And then finally, our final presentation is going to be given by Hannah Manella. Hannah is our oncology dietitian at the Cancer Center, and we're also very lucky that she is a qualified exercise physiologist as well. And so this, after all those genetic topics, Hannah, we're going to go to something a little bit lighter. Hannah is going to bring us some information about a new trend where you can train to prepare for treatment in the areas of nutrition and physical activity, not just to train for the treatment, but to manage treatment-related side effects and improve a patient's tolerance to cancer treatment. I have not heard anything about this, so I'm really excited to hear what you have to say. Thanks, Hannah.
Thank you. All right, everyone. So let's see if the slides are coming up. Okay. Hi, everybody. Again, my name is Hannah. I'm one of the oncology dietitians. I'm also a clinical exercise physiologist. And today is my Cancer Connections debut. So thank you all for being here. Are you guys getting a green box around the screen right now, or is that just me?
It's just you.
Okay, great. Perfect. All right. So really the focus of this presentation, if I can have any takeaways from today's talk, is I'm really challenging individuals to shift their mindset of how they're approaching nutrition and physical activity during cancer treatment. So many times I meet with individuals when they're first diagnosed, they're of course feeling discouraged and overwhelmed. And people make comments to me and they're like, I just have to get through treatment. If I offer a visit or something like that, they're like, it's going to be okay. I just have to get through treatment. But really, I love it when I'm able to have the conversations with individuals that they're asking, Hannah, what can I do to fuel my fight? What can I do to strengthen my body during my cancer treatment? And that's really how we should be approaching this, because there's so much emerging research on the benefit of nutrition and physical activity during active treatment to help strengthen your body and fuel your fight. But what does training for treatment mean? I'm going to make this clear up front that this does not mean macro counting, like strict nutrition regimens, heavy bodybuilding, strength training, or like heavy strength training, those kind of things. It's not about this. It's not like training for an ultra marathon or anything like that. Really what it is, it's simply shifting your mindset away from the idea of what I can't do and fixating on the negatives versus looking more so on what lifestyle behaviors can I adapt to really help fuel myself during treatment. So a lot of it is just a different outlook and perspective on how you're approaching treatment. Original thoughts. This is extremely common. These are comments I get probably on a daily basis, and expectations that individuals have when they're starting treatment is, first, I'm going to lose weight. I hear that all the time. They're like, I know I'm going to lose weight on treatment. And that does not have to be the case. It happens a lot, but hopefully with early nutrition and physical activity interventions, we can prevent this from happening. Also, I have to rest and take it easy. That is something that was being told by a lot of oncologists in the 80s, 90s, early 2000s, and it might even still be told today. But really, the emerging research in recent years has shown that this concept of resting and taking it easy actually does more harm than good in the long run. And then last but not least, treatment-related fatigue is one of the most common side effects associated with treatment. And so a lot of people just don't think they're going to have the energy to either cook or exercise or really take care of these kind of things. So hopefully by targeting that fatigue early on, we're able to help combat this as well too. And I'm going to take each of these comments and we're going to go through them a little bit more of why we should shift our mindset away from these original thoughts. All right, unintentional weight loss. So why is this something that I'm so concerned about as a dietitian? Or why is it something that the medical team watches so closely throughout your treatment? What we have found is that weight loss, especially weight loss that happens unintentionally, and at a significant level, anything more than 5%, increases your risk of losing muscle over fat. So we find that the body shifts to more of a hypermetabolic state. So the body's working in overdrive to fight the cancer, to circulate the chemotherapy through, to refuel our body, those kind of things that if it doesn't get enough energy from nutrition, it's going to pull from the easiest energy source in your body, and that happens to be your muscle stores. So what we find is that if individuals lose significant amounts of weight, anything more than 5%, individuals going through treatment have higher rates of treatment delays. They have loss of independence. It's more difficult just to do their activities of every day, tissue healing delays, slow recovery between chemotherapy cycles, more fatigue, and then just in general, decreased ability to fight infection as well too. So all in all, treatment is not the time to lose weight. A lot of people even come to me and they say, Hannah, I have some weight to lose. This is okay. And then I explain this concept to them that, okay, maybe you might have fat mass that you would like to lose, but unfortunately, this time isn't going to be the time that you're going to be able to target that fat mass. It's likely going to be pulling from your muscle stores, leading to more long-term complications. And then loss of muscle mass. We're on the topic right now. Let's just talk about it a little bit more. So loss of muscle mass specifically can occur from a number of different reasons during cancer treatment. As I described on the last slide, hypermetabolism, or this body's shifting energy needs, increases the risk of muscle being pulled if you're not taking in enough nutrition. And also we do find that a cancer diagnosis as well as cancer treatment increases the body's calorie and protein needs. So we need to take in more. So whatever you were eating at baseline to maintain your weight pre-diagnosis, we typically have to increase our calories during cancer treatment, anywhere from 300 to 500 calories, depending on the person. So we could end up looking at something like an extra snack or two throughout the day, or an extra supplemental beverage or something like that can typically make up for this. But people are going to really feel as though they're having to eat a lot more just to maintain their needs. But it's challenging to eat. So then you have to work, ideally would work with a dietitian to help manage your symptoms and side effects, to help ensure that eating and meeting these increased needs is practical for you. Also, we know muscles are one of those things that, if you don't use it, you lose it. So we find that with decreased activity, increased sedentary behaviors, more fatigue, those type of things during treatment, people aren't being as active. So you are going to have a level of muscle loss as a result of just the lack of activity as well, too. All right, but low muscle mass itself has a lot of complications. So we have done a lot of research over the past 10 years, looking at long-term side effects or side effects during active treatment and the impact of low muscle mass or muscle loss has on that. And we found a number of negative outcomes associated with low muscle mass during treatment. More hospitalizations, longer hospitalization stays, increased chemotoxicity. So people just aren't able to tolerate their chemotherapy as well, and they might have to have dose reductions as a result of muscle loss, lower survival rates, shorter time to progression, poor quality of life. If you lose your muscle stores and you don't have the energy or capacity just to complete, daily tasks like emptying the dishwasher or doing a load of laundry, that's going to impact your quality of life because you're going to be more reliant on other individuals to have to help. More complications from surgery, and then in general, just physical impairment and disability. It's harder just to move if you lose those muscle stores. And then treatment-related fatigue. So as I mentioned, this is the most common side effect associated with cancer treatments, whether it's chemotherapy, immunotherapy, radiation, it's the most common. We do expect that 90% of individuals are going to experience this fatigue during treatment. And it's more than just a physical fatigue. It's a mental fatigue. It's so much more than just feeling tired. And it's extremely common. But it's not something that we should just try to ignore and just work through because we know it leads to complications. So if you look at this chart here, we find it's this vicious cycle. So an individual is fatigued. So what do? They rest and they take it easy, right? They become more sedentary. But what happens if you're becoming more sedentary? You're not moving your muscle stores. You're not moving them. You're going to lose them. And that leads to physical deconditioning, leads to muscle loss, which further exacerbates fatigue, and it just feeds into this cycle. So it's one of these things that we do need to try to target early on and not just expect it to happen and just deal with it, because it can end up leading to bigger issues down the road. But we do know that sometimes you can target the specific cause of the fatigue because there are a lot of different things that can lead to fatigue. The cancer treatment can itself, but then also low nutrient intake. So can I eat more to make sure I'm meeting my needs to to ensure that I have enough energy to do everyday tasks. I'm being more sedentary maybe. So maybe I just need to try to walk more often, or maybe I'm having more pain. So I need to work with my team to make sure I get my pain managed. It's impacting my sleep, anemia. Maybe I need to meet with my team to address this, and then just emotional, side effects and stress. And so maybe working with our therapists or counselors can be an option as well too. All right, so training for treatment, what does this mean? So it's not this crazy complex idea, but really it's just being intentional about nutrition, physical activity, and sleep and stress management. Because if you think about it, if you would think about an individual training for a sporting event, what are they going to focus on? They're going to make sure they're eating enough to fuel their body for their event. They're going to make sure that they are being pretty strict, not necessarily strict, but regular with their physical activity to ensure they're able to meet the demands of the event. But then they're also going to be really conscious of their sleep and their stress as well too, just to make sure that it's not getting to be too overwhelming and they're managing the full picture. So when we look at nutrition though, we know, as I mentioned, the body shifts to a more hypermetabolic state. So it needs more calories, it needs more protein. We want colorful plant foods, though. I'm a dietitian. I am an oncology dietitian, and we know the benefit of antioxidants and the benefit of plant-based foods. So, of course, I do not want to overlook that. Grains and starches can be a fantastic tool during cancer treatment. Our body's primary fuel source is glucose, which is from carbohydrates. So if, I could always meet with, I know you guys off camera at another time about this, but there's a lot of negative rep for carbs during treatment, but I will say can be a really, really positive addition to your diet. And then of course, adequately hydrating as well too. That's something that the treatment team and everyone is always pushing, and because it's really important. Physical activity, ideally during treatment, individuals are still doing a combination of aerobic and strength training activity if they can. And ideally, if possible, I want people to try to continuously do more. So if they are regularly walking 20 minutes 3 days a week, ideally, I would love to see 25 minutes 3 days a week or 20 minutes 4 days a week. So always trying to progress. All right. Okay, so nutrition during treatment though. Ideally, the goal of nutrition during cancer treatment is I want individuals to eat as healthy as possible, but we have to be practical and we have to manage treatment side effects. And then we also have to manage any previous diet restrictions. So when I'm referring to general healthy eating during treatment, what am I saying? I'm saying a well-rounded diet that has to be rich in calories, right? We need to make sure that individuals maintain their weight, ideally. So need to eat ideally more calories, 300 to 500 more calories a day to meet your needs during treatment. I want a protein nearly almost every single time an individual is eating to ensure that they're getting enough, because protein needs increase during treatment. And we want to ensure that there's enough circulating protein to help rebuild or maintain tissue, specifically muscle, right? If we want to maintain muscle stores, we have to eat protein. Nutrients, getting a well-rounded diet just to make sure you're getting your vitamins and your minerals through your food, just since there are a lot of vitamin and mineral interactions with treatments. We don't always like to go the vitamin and mineral route. We'd ideally like to meet that through food first, getting enough fluid, and then being conscious of food safety. The last thing people need during treatment is any food poisoning. So we just want to be safe. Managing nutrition-related side effects, though. So of course, we cannot overlook this. Of course, we know that treatments, whether it's chemotherapy, potentially immunotherapy, radiation, they come with their own side effects that oftentimes impact eating and ability to eat. And so this is why oncology dietitians can be extremely helpful, because we're versed in these side effects and we really understand foods that are well tolerated based on how things are going. And we know that these side effects can decrease your intake. So ideally, we want to work through that, help find things that go better to help you meet your needs. Again, poor appetite, nausea, vomiting, constipation, diarrhea, the list goes on. And then previous diet restrictions, we want to be conscious of this. So we know balance is key. So we do want to try to maintain previous diet restrictions as much as possible. There might have to be some flexibility, though, depending on the severity of your treatment side effects. If you really, really are having a hard time eating, my priority is getting you to maintain and keep your weight on. So there might be a little more flexibility during that time, but ideally we do want to maintain any previous diet restrictions, whether it's diabetes, kidney disease, heart disease, or any medication interactions. We still need to respect those during treatment. All right. And then key nutrients during treatment. So these are things that we really want to keep in mind, since we do know that cancer treatment places a large demand on the body. As I mentioned over and over, we have higher calorie and protein needs during treatment, and we want to maintain weight, and we specifically want to maintain muscle stores. So ideally, we want to prioritize calorie dense foods first. And we know carbohydrates and fat actually provide the bulk calories to maintain our weight in our diet. So ideally, having a combination of good carbohydrates, whether it's fruit, starchy veggies, whole grains, pasta, cereals, beans, dairy, those kind of things can all be really helpful. But then also being intentional with our healthy fats as well too, because we can add calories easily without impacting the quantity of food that we're eating. Things like oils, nuts, seeds, avocado, full fat dairy, coconut, those types of things can add in the calories without impacting the amount that you have to eat at one time. So it can be really, really helpful. Of course, there's going to be some cancers or cancer treatments that impact your ability to digest things like fats. So that's why it's really helpful to work with a dietitian to kind of help figure that out. But as I mentioned, the next category, protein, is extremely important. Ideally, every single time you eat, I want a protein source incorporated on the plate because it's essential to repair body tissue and maintain a healthy immune system. So you need extra protein. So that's why it's really important to try to get a little bit of protein on the plate whenever you eat. This is the whole idea of training for treatment, right? An individual that's training for an athletic event is going to be pushing protein. People during treatment should be pushing it too. But it does not mean that I want half your plate full of protein. No, a small portion can absolutely meet your needs. And then we might have to adjust your proteins based on side effects. I know a lot of people cannot chew on a chewy chicken breast or piece of steak during treatment just because it's just not appealing. So you might have to shift to a softer, more flaky version that's a little easier to eat. Good sources: lean meats, fish, poultry, eggs, nuts, beans, lentils, soy foods, but then also protein powders and supplemental beverages can also be options too. All right, so I'm trying to get through this. I want to be respectful of all your time. But one way that I find is really helpful to try to put all of this together is the plate method. So it's something that if you've met with a dietitian before, they may have talked about the plate method, but I kind of look at it a little differently during cancer treatment. It's an easy way to help you balance your meals to ensure you're getting a variety of different foods to help promote satisfaction, but also meet your needs during treatment. The first thing when you're planning a plate though during cancer treatment, I kind of encourage people to shift their focus. And the first thing is an appealing and well-tolerated protein source. So again, that's what I'm really focusing on right now. So I want to make sure there's a protein on the plate, but 1/4 of a serving or 1/4 of the plate full is adequate to meet that protein need. Second, ideally, I want to try to hit a lot of different colors to optimize antioxidant intakes and vitamins and minerals. So let's add some colorful vegetables or fruit to the plate. If you can, though, this might be your opportunity to be a little more liberal with your oils. So maybe you're adding a little avocado on top, or maybe you're using a little extra olive oil right over the top of your vegetables just to increase your calorie intakes. And ideally, rounding off the plate just to ensure you're getting a satisfying meal, we want to include some grains and starchy vegetables in the remaining section. All right. You might need low fiber depending on how things are going. If you're having diarrhea or if you've had any recent GI surgeries, you might be on a lower fiber diet. So you want to try to make sure your veggies are cooked and make sure your grains are more refined and more gentle compared to any whole grain options. All right. But something to keep in mind, your meal might not always look like that during treatment because symptoms can make it challenging. It might be something as simple as a scrambled egg, a piece of toast, and maybe a couple sauteed veggies on the side. And that might be it. But really, it's just adjusting your diet to based on how your symptoms are going. But we still want a protein. I still ideally want a little bit of color, and I still want a grain if possible. All right, going to the next category, we talked about nutrition during treatment and how important that is for training for treatment, but then we also want to talk about physical activity. So we've been able to find over the past decade, past 15 years, the importance of physical activity during treatment. So it's actually been proven that physical activity should be encouraged, continued, and it should ideally continue to progress throughout treatment. Ideally, we want people to continue to meet the physical activity recommendations for Americans during treatment. And what is that? That's 30 minutes of activity 5 days a week. ideally during treatment. That might sound like a lot to people during treatment, but they do find that regular physical activity is associated with a lot of really great outcomes. And they actually now say that physical activity should be a standard of care and should be encouraged right at the time of diagnosis. So really, though, we understand that physical activity is not always as straightforward during treatment. So we do, ideally 30 minutes, 5 days a week is the goal, but the goal really is actually just to limit sedentary time and just try to be as active as possible. We find that any activity is better than nothing. Start slow. So it might be, if you're just getting going again, your physical activity might be a 5-minute walk, and that's okay. A 5-minute walk is better than 5 minutes on the couch. So it makes a difference with the goal of trying to hit 30 minutes. But the nice thing is 30 minutes doesn't have to all be at one time. It can be broken into 3-minute intervals, 5-minute intervals, 10-minute intervals, whatever is easier for you, just to help you be more active throughout the day. Because we know physical activity has been found to be the most successful strategy in managing treatment-related fatigue. As I mentioned before, almost 90% of individuals during cancer treatment will experience this fatigue at some point. They've looked at different interventions to manage this fatigue, whether it is more sleep or physical activity or medication regimens or those kind of things. And they find time and time again, the most effective strategy in combating this is through physical activity. It's not this kind of fatigue that gets better with resting. It's one of those fatigues, if you're kind of going through treatment, you're like, I don't know, I might need a nap. I challenge you to go on a 5-minute walk. If you're done with that 5-minute walk and you're feeling more energized, then there you go. You knew that you just needed to move your body a little bit. If you're still tired after that 5-minute walk, take that time, maybe take a short little nap just to kind of give yourself that time that you think you need. But if we want to target specifically cancer-related fatigue, we actually know how much is needed. We've actually found that 30 minutes of activity 3 days a week, not the 5 that's recommended in general, only 3 days a week has been found to significantly reduce cancer-related fatigue. Or if you're more of a strength training kind of person, you'd prefer just kind of do just some light lifting or like some light body weight exercises. You only have to do that twice a week to combat that treatment-related fatigue. We don't want to overlook rest, though, and the importance of resting, and especially with fatigue. We know healthy sleep routines are essential. Ideally, they still recommend trying to get 7 to 8 hours of sleep a night, trying to adhere to consistent sleep schedules. Take short naps and breaks if needed, but ideally, I don't want you resting all day, because if people are taking 2-3 hour naps, that limits their time to eat or be physically active. So do you want to make sure that you are limiting nap times? Ideally, the recommendations are 30 minutes or less, but I know that's not always the case. Really, the biggest thing is finding activities you enjoy at the end of the day. So in order to be active, you have to find something that you want to do and want to participate in. So whether it's walking or dancing or biking or just being more active around the house, those are absolutely all different ways to be more active. All right, so kind of putting it all together again. So this whole concept of training for treatment, and just trying to adjust the way that you are approaching or your mindset to treatment. Cancer treatment and athletic event, there's a lot of similarities at the end of the day. What do you want to focus on? A high calorie, high protein diet that's going to be the same during treatment as well as training for an athletic event. Adequate hydration, regular physical activity. So we do want people to be active during treatment. We do want you ideally to progress your activity if you can. If you have the opportunity to do a little bit more, maybe you're adding a little bit more weight, maybe you're going for a faster walk or a longer walk. We do want to progress as much as able. And then really being conscious of rest and stress management as well too. With the end goal for cancer treatment and an athletic event to fuel your body, to meet your increased nutrient needs, to prevent muscle loss, or even maybe build some muscle if you can, to improve your energy or decrease that fatigue, and to improve outcomes, whether it's at an athletic event or cancer treatment. All right, that's all I have for you guys today. Thank you for listening, and I'll take any questions I think we'll have.
Hannah, you are a champ. You got to all the points, all these beautiful slides, and you talked fast, but we understood every single word. So we appreciate you being conscious of time. You did a great job. I have one very important question that has been waiting. It's to please clarify, is it important to avoid antioxidants while you're on chemotherapy? Specify fresh vegetables and fruit versus supplements of antioxidants. Is there... evidence that supports any of this diet limitation while you're on chemo or radiation. I've heard personally a lot of different versions of what you should limit. We get a lot of questions about sugar, and in this case, antioxidants. Can you just speak very quickly to that for us?
Yeah. So one of the big things to keep in mind is it's specifically with radiation treatment, we do want to be extra cautious about antioxidant supplements specifically, just because the function of radiation is it oxidizes our cells. So we don't want high dose antioxidant supplements because it potentially could go against what radiation is trying to achieve. So really, when we talk about antioxidant supplements and treatments, we're talking about supplements, those high mega dose supplements, because that's really where the risk has been associated. We're not finding the same risk in a food source just because that a quantity that you're able to actually consume is likely a more appropriate quantity of antioxidants, and they're not associated with interfering with chemo or radiation at the same level. So we still recommend people trying to follow a plant-forward diet pattern during cancer treatment, just because the antioxidant doses in food have not been found to have the negative side effects of high dose supplements. So no high dose supplements during treatment, but food first is what we want to recommend. And then we also do recommend trying to avoid like heavy juicing and things like that, just because it does increase your total quantity of antioxidants and things like that you can get in one sitting. You would not be able to eat that type of fruit and vegetable quantity regularly. So we would want to limit that.
And then just one very quick exercise question. Could you just review any conditions where exercise would be contraindicated for the patient?
Yeah, so there are definitely going to be some, and it's something that a lot of the times your doctor will tell you if you do have contraindications. One of the big ones is if you have any bone metastases, you're going to want to get clearance likely from like a physical therapist or something like that prior to getting a program going. Otherwise, if you have any really significant cardiac or pulmonary history, you'll likely want to meet with a physical therapist if you're not physically active. But if you're also just questioning it, you're like, I haven't been active for a while, I'm just feeling really weak from my treatment, and I don't know where to start, a physical therapy referral is going to be really, really important, because they'll give you that clearance, or they'll work with you for a while until you're ready to independently exercise.
This was wonderful, Hannah. Thank you so much. It was a great presentation. It was a great way to wrap up the evening with your energy. We appreciate the information. All of the, let me just kind of do a wrap up here. All of the presenters today are members of the Cancer Center. So certainly we have experts for us here that can help answer any of the questions as we go forward. I'm sorry, we're kind of out of time now. I do want to thank all the speakers for all this practical information. I did want to make it known to those that have stayed on the presentation with us, which is most everybody, that we do have this presentation recorded, and the recording will be accessible to all of you. It will come in some of the information related to the program that you'll get after we conclude here. We appreciate your engagement. We appreciate the questions that you've asked, and it was great information. We thank our speakers again. Good night, everybody. Thank you for joining us, and we hope to see you at the next Cancer Connections in the summer. Bye now.